Hi everyone, I am Elizabeth Miller, Functional Medicine Health Coach at Valeo Health and Wellness Center in Eden Prairie, and I'm here today with Dr. Aaron Morland.
I'm super excited, Elizabeth, about this video. I think the big reason why is we're finally getting into, we've got past the what is Alzheimer's, talked a little bit about just introducing Alzheimer's in general, and now we're really getting into those types of Alzheimer's where we can really start giving people some information that's going to really change their life, because this can really help them to see which category they fit into and the things that they could be doing to help themselves so that they can, again, either prevent it, slow it down, or even reverse it in some people.
Yeah, that is the exciting part of this video series. And so today we're just starting off with type 1 inflammatory Alzheimer's, right?
Absolutely, yeah.
So with that, a lot of times when people think about inflammation, we think about, a mosquito bite, you experience inflammation with that, or a sprained ankle or some sort of joint injury that causes inflammation. But is that the kind of inflammation you're talking about with?
And definitely people are aware of that type of inflammation. They injure themselves, they know it, it comes with pain, it swells up.
You
and
can
maybe
feel it and see
absolutely, you can feel it, see it, it's itchy, there's just so many symptoms that come along with it that it's not usually something they have to guess, so like, oh, do I have inflammation? Because they know there's an event and they know your body reacted.
Right.
So it's a little different than that, because the inflammation we're talking about, the brain itself doesn't have pain receptors in it, so a person won't experience pain from it. They won't experience that swelling or notice that they're swelling, because there's no pain involved, and there's really no itching either that comes with it. And so the type of inflammation is definitely different, but it's really the same type of inflammation that does happen. We just don't feel it. So we can't see it because it's in our skull, and we can't feel it because there's no pain receptors there. So it is different that way.
Yeah, so in that case, what sorts of symptoms would we be looking for to know that there's even inflammation?
Good question.
Going on?
How would you know? Do I even have inflammation?
Yeah.
A few different things a person can find that out from. One is just different parts of the brain not working the way they're supposed to, and obviously in Alzheimer's, it's going to be some signs of memory loss. And but some of the other things that a person could have is before they have the memory loss, they may start to notice some other things like brain fog. They might notice some fatigue. They might notice that, like even when they're reading a book, find like, boy, I can't read for more than 5 minutes and I'm falling asleep.
Yeah.
Those are the things that they're going to have to watch for. And then there are some blood labs that we can look to see if somebody's dealing with chronic inflammation that's in their body, but also specifically up in their head. Okay,
interesting. And one of the things that we know, at least we know, can cause a lot of inflammation is this standard American diet.
Yeah, or the SAD diet.
Yes, the SAD diet.
Yeah, and it's a diet that we were taught back in the 80s and 90s, if you remember the food pyramid from when we were kids.
Sure do.
And remember what was on the bottom of the food pyramid?
6 to 11 servings of grains, basically.
Yeah, so if you look at that, and I remember when we were kids having to eat that way, trying to get 6 to 11 servings of grains in your diet every day really was actually a bit of a task, and so you really had to eat a lot of processed grains to get it. So you would eat bread, pasta, cereals. I remember breakfast we would have toast and cereal. At lunchtime you'd have sandwiches. At supper you always had a loaf of bread, and you put your margarine on top of that bread. You'd always eat that with your meal. And the problem with that is we are now seeing that diet has actually led to, it's a pro-inflammatory diet. And so it's led to people getting a lot of inflammation from those foods. And the interesting thing is that food pyramid put fat at the very top with sugars. Now, I think what they probably meant was that it was bad fats, but they really didn't classify that. They just said fats, eat sparingly, the same as sugars. And so you can see that as you look at that pyramid, you can see, wow, we set ourselves up to have a lot of inflammation just due to the food that we eat. So we look at those carbohydrates too that those grains are mostly made up of. they can get converted to sugar pretty quickly. So then we all of a sudden start diving into this type 2 Alzheimer's, or that insulin-resistant Alzheimer's, which we'll talk about in the next video. But you can see how that standard American diet caused inflammation, but it also led to other health issues as well that we'll be talking about.
Yeah. And when it comes to inflammation in diet, too, can you talk a little bit more about other things that kind of contribute to that inflammation? Like leaky gut.
So the diet can definitely, if you eat that diet, what the problem is it can lead to other issues. So the diet in and of itself can cause inflammation just because of some of the chemicals, what that food's made up of. But then it can also cause damage to a gut and just cause a compounding issue. You'd mentioned leaky gut, so some of the foods we eat can actually cause damage to our gut. And when we think of our intestines, our digestive system, we have to understand that when I put food in my mouth, I swallow it, it goes into my stomach, goes into my small intestine and large intestine, is that food's technically not inside your body. It's not inside your body until it crosses that intestinal barrier.
Right.
So the digestive system is really a barrier that allows certain things in and keeps certain things out, and just like your skin would, right?
Right.
And so what's supposed to happen is you're supposed to break down that food, get rid of things that aren't supposed to be there, never allow them into our body. So we break them down small enough that that's the only thing they can cross over. But when you have a leaky gut, things can cause damage to that intestinal barrier. Now that barrier is compromised. Now larger things over. And so just to understand for the viewers is we're going to make a video specifically just on leaky gut, because it's a pretty complex topic, and it'd make this video really long if we went into great depth about it. But know that leaky gut can allow for inflammation in the body as well.
And another one that we know has to do with inflammation too is SIBO.
Yeah, absolutely. So SIBO, it's just an acronym. It stands for small intestinal bacterial overgrowth. And what that means is, your small intestine really doesn't have a lot of bacteria living in it. That's mostly in our large intestine. But given the right environment, that bacteria can move from the large intestine up into the small intestine. So it may not be that it's a bad bacteria, but it's just in the wrong place.
Right.
And because it's in the wrong place, it can also lead to the leaky gut. It can lead to your body not getting the nutrients, because this bacteria now is getting to eat the food before you get a chance to break it down, and so now the body's not getting those nutrients. And so one is they cause the leaky gut, which can then cause inflammation, and then two, SIBO can also cause like a nutrient deficiency. So it goes back to, now we're diving into another type of Alzheimer's, which would be that trophic Alzheimer's, where I'm not getting the things that my brain needs. And so you can see how these things are all, a lot of them overlap.
Yeah, and can you really quickly just give a couple of different things that someone might look for if they think they might be experiencing SIBO?
Yeah, and this is another one that we're going to make a video on, because it's another one that goes into great depth. But I would say the easiest and the first symptom to notice is when a person starts feeling bloated 3 to 4 hours after they've eaten. They'll literally, some will come into the office and say, I feel almost like I'm pregnant, that my stomach is distending so much. And so it's a few hours after they eat, they'll notice bloating is probably the number one and the easiest sign of someone dealing with SIBO.
Okay. And then another thing that really goes along with the gut and Alzheimer's is food sensitivities. Can we talk about that for a little bit?
Yeah. And so a person can have a food sensitivity for a couple different reasons. One, when we look at that overlapping again, we look at someone dealing with a leaky gut. Yep. So again, what's supposed to happen is we're breaking down those particles so small that they can get across the barrier. But if I have a leaky gut and I eat some food and it's got a large protein in it, and that large protein is never supposed to cross into my bloodstream, but because I have a leaky gut, it can. Now my body's immune system responds to that protein. It's never seen it before. It attacks it, causes inflammation. But now, the next time I eat that protein again, that food, I'm going to react to it again. So that's one way that a person can have a food sensitivity, and that can lead to inflammation. Another is they may have a completely intact intestinal wall, but we have these cells in our immune system or in our digestive system that almost reach out and keep grabbing things and just testing them. But if I have a heightened immune system already, either from a leaky gut or from other things that I'm being exposed to, then my body may react to those foods, which it really wouldn't normally. So now it reacts to it, so the next time it comes through and those cells, those immune cells, reach out and grab it, like, oh, this is something we need to attack, and so you can develop a food sensitivity that way as well. And so that intestinal wall that has that immune system lining it, now you've got a heightened immune system and you can start to respond to a lot of things. And unfortunately, you'll see people coming in and they'll say, yeah, I can really only eat 5 or 6 different foods now. I've eliminated all these other foods. Well, that's not normal. That's
right.
That person has something else going on. It's not just, yeah, I'm sensitive to all these foods. And again, another video, right? Because this here is a topic that's just so in depth that we really need to go into more detail to help people to understand that food sensitivities are not, some people are sensitive to them because of certain things, their genes or whatever, but really for most people those food sensitivities, they can be healed of those food sensitivities if they did the right things.
Yeah, which is really exciting to hear.
Yeah, especially if you're only eating 5 or 6 foods.
Exactly, to know that there's hope.
Yeah, you're really limited to what you can eat, and that's just not normal. That shouldn't be the case.
Yeah. And what is the relationship with stress and all of this? Because the standard American diet is one thing, but we really are dealing with more of a standard American lifestyle, and it includes a lot of stress.
Yeah, and I think we have to understand that there are a couple different types of stress. There's stress that's good for you. You go to the gym, you work out, you stress your body, and it gets stronger. That's a good thing. And we're talking about the stress, though, that your body just can't overcome. It's overwhelming, from our work, our family, to just our day-to-day life, driving to work. It can be a very stressful experience. And when we have that stress, we go into that fight or flight. And so if you think about the fight or flight, what kind of things do you think are happening in your body when you're in fight or flight?
Basically, kind of like those non-essential things are shut down, basically. Like when I think about fight or flight, my body's not thinking about digesting food.
Yeah, if I'm being chased by a bear, I really don't need to digest that lunch that I just had. Because I may never live past the next few minutes, so it really wouldn't matter if I digest that food. So the body intelligently does things like shunts blood away from our digestive system to the parts that need it, like our muscles and such. But the other thing it also does, so you don't have that blood flow, but you also don't have the digestive enzymes now. You're not producing those. So again, you're not breaking down those nutrients. That food just sits there. Now again, this whole overlapping experience of how these illnesses can all come about. Now, if I just have food sitting there, I'm going to have that bacteria move from my large intestine to my small intestine. Now I'm going to get SIBO. SIBO, what also happens with SIBO is as they eat that food, if they're out of food, they start eating your digestive wall. So there's just, so it's really a spiraling effect when you look at stress in that manner. But you also release a lot of a hormone called cortisol, which is a good thing because it helps you to make more fuel so you can get away from that bear. And so that's a good thing, but the problem is large amounts of cortisol are really damaging to our brain, specifically the hippocampus. And the hippocampus, again, is where we create memories from. And so if you're just being chased by a bear, that event's going to last minutes. Okay, it's either that bear's going to catch you or you're going to get away from that bear. But when we're dealing with chronic stress, that's always happening in our body, and you can see how damaging that can be.
Yeah, that prolonged exposure.
Yeah, it can cause that inflammation as well.
Okay. And something that can be gut-related a little bit, but moving also slightly away from it, is infections.
Yep.
So how does that relate to gut health, but also in general to type 1 or type 2 Alzheimer's? Yeah,
so again, if we look at type 1, if we look at how people think of infections, we tend to think of, I've got a cold, I'm going to get sniffly, or I'm going to throw up, so all these different infections. But we also have infections that I think most of us know about, like if you've ever heard of Epstein-Barr virus, or mono is what most people know it as. we also know that when a person has exposed to mono, you really have it for the rest of your life. It's
Right.
something that you carry. We look at the herpes simplex. If you get cold sores, that virus is just always on our body. What happens then is our body could, their immune system could be constantly fighting that. So what we call a subclinical infection. What I mean by that is you really don't have outwardly symptoms. Even if you did a blood test, they may not even look and see that you have an infection, but you could have an infection. And when you have an infection, your body's constantly fighting that off, and it's going to constantly release inflammation because that's part of your immune system's response to infections. And we can get those infections through that leaky gut we talked about, but you can also have compromised other barriers, like the lungs can be a compromised barrier. So that being said, is infections, which include bacteria, viruses, parasites, those could all lead to a person dealing with inflammation due to infection.
And I know one of the big ones that we haven't yet mentioned is Lyme.
Yeah. So Lyme disease, which I think most people, again, when we've been taught about Lyme disease, is you're going to get it from a tick, you're going to get this bullseye sign, and you'll know that you got exposed to Lyme disease. Now, that is the case for some people, but we also have to understand that Lyme disease is not just carried by ticks.
Right.
And we also have to understand is many of the people do not get that bullseye, and some people don't even know that they got exposed to it because at the time they were pretty healthy, but then they go through, and then that Lyme disease, that bacteria, stays in their body. They don't know they got exposed to it until they go through a time where they have a high amount of stress or something else that compromises their health. All of a sudden that bacteria sees it as, hey, here's an opportunity for me to now
gets activated.
Exactly, and that immune system is busy doing something else, so now it can happen. So Lyme disease is a big one, and it's something that you need to really understand. Again, this is another video that we're going to do because that is just such a significant topic that we could talk for hours on it, actually.
And then I know that we briefly discussed this in one of the first videos, but how do genetics come into play specifically with type 1 Alzheimer's and all that we've discussed today?
Yeah, so again, we're talking about that APOE4 gene, and in one of the videos previously I had mentioned that it's actually a gene that's protective, meaning that if you have that gene and you're in a place where you're getting exposed to a lot of bacteria or you're getting exposed to things where you have to fight off infections or whatever, that's a good gene to have. It actually is very helpful, but the gene releases a lot of inflammation, causes your body to release a lot of inflammation because it's so good at helping you fight off those things. So again, if that was just a short-term thing, if you just got exposed to a bacteria once and your body took care of it, it would be a good thing. But if you're dealing with a chronic infection and it's constantly doing that, you're constantly releasing those inflammatory markers, and then what happens is that person can have inflammation of the brain because of that. So.
And, mentioning inflammatory markers just brings me back to the beginning of the video, when we talked about how do we know if there's inflammation, in those tests that you had mentioned.
Yeah, so we talked about symptoms, and the problem with symptoms obviously can be, well, I don't have pain, I don't have swelling, so I must not have inflammation, but yet a person could.
Right.
And so how can you find that out? We talked about some of the symptoms, but there's also testing that a person can do.
Well, yeah, and especially just because some of these symptoms you might not necessarily associate with inflammation, like fatigue.
Yeah, you might just think, I didn't eat enough.
Right,
or
I have a busy life, of course I'm going to be tired.
Yeah, absolutely. So you look at blood labs, you can look at those inflammatory markers that I was talking about. So you could do some general ones like homocysteine and CRP, but then you can get into more detail where you're looking at some of the cytokines and interleukins, and those are all inflammatory markers, and they can be measured through the blood. So that's one way to determine if a person has it through some of the testing that we do in the office here.
Okay.
Yeah.
Cool. Well, I think that wraps up all the questions I had for you today, unless there's anything in particular that you're wanting to add.
Yeah, no, I think that, again, just understanding to the patient that we're going to be making a video on this, on how to address this, what kind of things that they can do in their own lifestyle, because again, it gives the patient, it gives the person some hope, because so many people, I think they think, well, I'm on that path, my family member has it, I'm just on that path, there's nothing I can do. And in the videos that we're going to produce in the future here, the ones that talk about what they can do, you're going to see that there's a lot of things, specifically for this one, there's a lot of things that can be done for inflammation.
Yeah, that is great to hear that there is a lot that can be done. There is that hope.
Yeah,
So.
absolutely. Yeah.
So like we said, stay tuned. There are more videos coming up on the other types of Alzheimer's, and then again, what we can do to combat that. Thanks.
Thank you.